Well, if you think things have been bad so far with Obamacare, brace yourself, because this new season of enrollment probably will see a substantial sticker shock. An analysis of Obamacare insurance markets show that about a third of all metropolitan areas project the premiums in the most popular subsidized plans going to rise by at least 10 percentage points. Joining me now, Kelly Riddell, Heather Hansen, and Peter Morici. Heather, I guess what we're seeing is some of these initial things put in place to sort of mitigate the increases are running off, and maybe this is the tip of the iceberg. It could get actually worse than this, can it?
I think it absolutely will get worse than this. I think that we see that these people are more sick than we thought. Things cost more money than the government thought. And this is only the very beginning of what we're going to see. There has to be a sea change in the way that Obamacare is implemented. You
know, Peter, you crunch numbers for a living. It never felt like this could work, but some bold promises were made. They've been broken early on. What do you think the economic damage is going to be? You know, we had the CPI report out today, and medical costs up almost 4% year over year.
Well, I think the economic damage is going to be significant. It's going to take away all the freedom we have within the budget to operate, because most consumers aren't going to see these price increases in very large measure. They're going to get a lot of subsidy from the government. But where does the government get that money from? You know, Hillary's going to want to tax the top, 10% a little bit more. But she talks about doing that for free daycare. She talks about doing that for free college tuition. She talks about doing that for a whole list of things. And even if Donald comes in, he doesn't want to cut the safety net. So where is this going to come out of? The fleet?
Yeah, Kelly, to that point, I remember when they were selling this, no one said anything about these subsidies, which I think go up to 140% above poverty. Which to me is amazing. It's it just doesn't stop. But we can't pay for it out of thin air. I mean, either the debt goes up, deficit goes up, or we might get tax increases and all of it goes up anyway.
Yeah, and you're seeing its effect on the job and the labor market. Goldman Sachs came out with a report last week saying that hundreds of thousands of workers have been pushed into part-time work because of the Affordable Care Act, which should be dubbed the Unaffordable Care Act. Now, we're only going to face worsening situations come 2017, because in 2017, that's when the risk corridor ends for all of these insurance companies, meaning the subsidy that the government's giving them to put out these unaffordable or these not market-priced plans is going to expire. So you're going to see in 2018 premiums even more increase. It could be a death spiral. You know,
we're already seeing major insurance company opt out of these exchanges. Heather, from a legal point of view, one of the big campaign promises from the Republicans is that, listen, let's get rid of it, let's abolish it and start from scratch. I'm not sure about the legalities of it, but it sounds very complicated now that this is in place.
I think that from a legal perspective, the best thing is tort reform. It is a major way to cut back on costs, because you've got to imagine not only are these doctors paying high medical malpractice insurance premiums, but they're also engaging in huge amounts of defensive medicine. And some estimate that that's 1 in 4 of our healthcare doctors is spent on defensive medicine, things that don't have to happen. So there's got to be a part of this has to be tort reform. It wasn't included in Obamacare. Whoever comes into office has to approach this from that perspective and bring some of these costs down.
Yeah, well, a lot of people say it's because the trial lawyers are the biggest donors to the Democratic Party that never can happen.
Absolutely.
Peter, if we can't completely tear this thing up, rip it up and start from scratch, is there anything that can be done? Because ultimately, apparently some people, some skeptics or conspiracy theorists believe this is all designed to fall apart and ultimately take us to a single payer system.
There's only 2 directions we can go in. We can't stay where we are. We move to a single-payer system, and we're going to have that in a lot of markets within a few years, because there'll only be one insurer in each market, and that'll be a de facto single-payer system. Or we get rid of the mandate. We get rid of the requirement that people have to buy health insurance, and we provide some kind of reasonable subsidy to every American to go do with as they please. But if we do that, they can't show up in an emergency room and say, I can't pay, and then somehow or other escape from the bill. You know, in Germany, wealthier Germans do not have to buy health insurance. Everyone else does. But they can't walk away from the bill if they show up without insurance. In the end, we have to go in one direction or the other. We can't stay where we are.
Yeah, I tell you, it's created so much economic havoc already. And, Kelly, you made the point. It's only going to get a lot worse. Thanks a lot, guys. Appreciate it.